In this Get Pregnant Now Quickie, we're going to discuss a nutrient that impacts your AMH, ovarian function, and fertility potential.
Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we?
In this episode, you'll learn how vitamin D may be connected to AMH and ovarian function, what the research actually shows, including some surprising nuances, and why low AMH is not always permanent, and what may be influencing it. So in our last episode on Tuesday, we talked about AMH, or anti-Müllerian hormone, which is produced by the granulosa cells of your ovarian follicles, and it reflects follicle activity, not just a fixed number of eggs. And here is a key point that many women are never told, and what we're going to discuss in today's episode is vitamin D. Vitamin D acts like a hormone in the body, and it may influence gene expression in ovarian tissue, including AMH production. Research has shown that vitamin D receptors are present in the ovaries, uterus, and placenta. Vitamin D metabolizing enzymes are found in ovarian tissue, and the relationship between vitamin D and AMH appears to be complex and individualized. In other words, low AMH does not always mean low fertility potential. Sometimes it may just reflect a nutrient signaling issue, not ovarian failure. So here's when it gets a little interesting and also a little nuanced. The research on vitamin D and AMH shows different patterns depending on your individual situation. In women with regular ovulation, studies suggest that vitamin D supplementation may actually increase AMH levels. One randomized controlled trial found that high-dose vitamin D increased serum AMH in young women within days. And women with adequate vitamin D levels often show higher AMH compared to vitamin D deficient women. And then we have in women with PCOS, vitamin D supplementation appears to decrease AMH levels, which may actually be beneficial since PCOS women typically have elevated levels of AMH. This suggests that vitamin D is helping restore balance, not simply raising or lowering AMH universally. And then if we're speaking about women with diminished ovarian reserve, one study found that vitamin D supplementation increased AMH levels from 0.5 to 0.79 after 3 months, and other studies have shown mixed results. So the takeaway here is vitamin D doesn't just automatically raise AMH, it appears to support optimal ovarian signaling based on what your body needs. And this is why a one-size-fits-all approach, which is typically what you get in the fertility treatment world, does not work for everybody. Vitamin D also influences follicle development, steroid hormone production like your progesterone and estradiol, ovarian sensitivity to FSH, inflammatory and immune balance in the reproductive system. And I just want to level with you here and be honest about something important. The research on vitamin D and AMH is still evolving, and research results have been mixed. So some studies show strong positive correlations, while others show minimal association. Some show seasonal variations in AMH that mirror vitamin D levels, while others don't. But what we do know is vitamin D clearly plays a role in ovarian physiology. It's not a simple more vitamin D equals more AMH equation, and individual factors like PCOS, age, and baseline vitamin D levels all matter. So this doesn't make vitamin D less important, it makes it more personalized, which is what everyone's fertility journey should look like anyways, is personalized and tailored to the individual. So why is this often missed? Most fertility clinics are only measuring AMH one time. It is an expensive lab to test, and they're not routinely checking or optimizing vitamin D levels. Really only if they're severely low do I see them taking action for vitamin D. And they treat AMH as a static lab result rather than it being modifiable. Yet, vitamin D deficiency is extremely common, especially in women with autoimmune conditions, thyroid dysfunction, PCOS or endometriosis, limited sun exposure. So, if you live farther north, digestive or absorption issues. If your body doesn't have adequate vitamin D, it can't support optimal ovarian signaling. And then, just also as like a side note, vitamin D needs other nutrients and cofactors for it to be able to do its job. So sometimes it's not just about supplementing with vitamin D, it's making sure that you have a very well-rounded nutrients coming in, whether it's from food or supplements. So how can we support healthy vitamin D levels? Vitamin D comes from sunlight, specifically from UVB exposure. This is one of the most effective sources. Fatty fish like salmon, sardines, mackerel, egg yolks, cod liver oil, and dairy products, of course. And you can use supplementation when needed. For fertility, most research suggests vitamin D levels 30 to 40 nanograms per milliliter, with some fertility specialists targeting around 40 to 60 nanogram per milliliter, depending on the individual. I like to see my clients more in the optimal range of 50 to 70 nanograms per milliliter. And something that is very important to note, always test before supplementing. Work with your practitioner to determine your optimal dose. Some women may only need 1,000 IUs daily, while others with severe deficiency may need 4,000 IUs or higher initially. Because this is not about megadosing, it's about restoring a fertility signal intentionally and specific to your needs. So just remember, AMH is information. It is not a closed door for your fertility. Low AMH does not mean you can't ovulate, you can't conceive naturally, and that you don't have options. And if you want to learn more about AMH, go back to this past Tuesday's episode where we talked all about it. What this means is your body is asking for support, deeper investigation, and better signaling. And vitamin D may be one of the places to look, especially if you've never had it tested or if your levels are below 30 nanogram per milliliter. But remember, this is about supporting your body's innate wisdom, not forcing a specific outcome. So let's recap today's episode. We talked about how vitamin D may influence AMH production and ovarian signaling, but that the relationship is complex and must be individualized. Research shows different patterns in ovulatory women versus women with PCOS, and optimizing vitamin D is a foundational evidence-based step in supporting overall reproductive health, and low vitamin D can impact ovarian function, making adequate levels essential for fertility potential. And just remembering your labs only tell part of the story, not the whole story. If this episode resonated at all, take this as an invitation to look deeper, not harder. And when we support the body at a foundational level with nutrients like vitamin D, we're not forcing change. We're creating optimal conditions for your body to do what it's designed to do. Until next time, take care of your hormones, your nervous system, and your hope. And if you want to finally uncover the hidden factors that are stopping you from getting and staying pregnant naturally, use the link in the show notes below to book a free fertility strategy session with me now, no strings attached. Thank you so much for listening. I hope you have a fantastic day, and I'll see you on our next episode, released every Tuesday and Thursday.
Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, This podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.